Good afternoon, everyone. Thank you very much for waiting. We have a fair bit to cover today, so please bear with me. It's been a very busy day considering the latest testing results and health advice. There have been meetings of the Emergency Management Team, the State Disaster Council, and of course the National Cabinet. And you'll have seen the decision to halve international arrivals announced by the Prime Minister and agreed to by the states and territories. This is a responsible way forward for international arrivals and will further ease pressure and risk in our hotel quarantine system. Today is day 4 of our circuit-breaking lockdown. I want to thank everyone for their understanding and patience and for doing the right thing. Whether you're inside the lockdown zone or in the regions, it shows West Australians are always willing to make personal sacrifices to keep each other safe and do the right thing. Lockdowns are tough on everyone, but until we have enough West Australians vaccinated, they are a necessary tool to get outbreaks quickly under control. Today I can confirm WA has recorded 1 new local case of COVID-19 overnight. Just to repeat, WA has recorded 1 new local case. The new case is a 21-year-old woman. She is the partner of case 1024, who was a staff member at the Indian Ocean Brewery. This new case, case 1029, has been in quarantine with her partner since Sunday the 27th of June. She tested negative on Monday the 28th of June and Tuesday the 29th of June. She then returned a positive test result yesterday. While no new case is good news, the fact that case 1029 has been in quarantine since Sunday is encouraging. We do not believe she has been in the community whilst infectious. As at 9 a.m. today, WA Health have identified a total of 383 close contacts and 356 have returned a negative result so far. That's roughly 93%. They have also identified 2,848 casual contacts, 1,725 have returned a negative result. That's over 60%. It's important that every West Australian keeps checking the website for any new exposure sites. New sites and times will be added if necessary, along with what actions people need to take. We do not want to miss any potential contacts. Yesterday, 10,974 tests were conducted. That's a good number this far into lockdown. Western Australians getting tested in these numbers means we now have confidence that we can take safe and sensible steps out of a lockdown and on a pathway back to normal. I can advise that as of midnight tonight, Perth and Peel will exit lockdown as planned. To repeat, our 4-day lockdown in Perth and Peel will end at midnight tonight. This is a great result that every West Australian should be proud of. We will then take 3 safe and sensible steps over the next 9 days to get us back to our restriction-free, pre-lockdown lives by Monday, July 12. I will now go through the steps. Please bear with me. From midnight tonight, or 12:01 a.m. Saturday, July 3, until 12:01 a.m. Tuesday, July 6, WA will have 3 days of post-lockdown interim restrictions. From tomorrow, people in the Perth and Peel regions will be free to leave their homes. Masks will remain mandatory as they are now, both indoors and outdoors, and on public transport. As they are now, masks will not be required for vigorous outdoor exercise and other exemptions. We are still asking you to work from home if you are able to. TAFE training and universities can reopen. From tomorrow, you can have private gatherings of up to 10 visitors indoors and 20 outdoors. All public venues, including hospitality, entertainment, and retail outlets, can reopen. The 4 square metre rule will be in place, with a limit of 20 patrons, not including staff, and seated service only. Can I stress, though, that these restrictions are intended to be for the next 3 days only. Weddings and funerals can go ahead with a limit of 20 guests. I know this is going to be hard news for many people, but the next 3 days we need to be extra cautious with the Delta variant. Public venues such as recreation centres, outdoor playgrounds, museums, swimming pools and fitness venues, including gyms, Pilates, yoga and dance studios, can reopen. The 4 square metre capacity rule and 20 patron limit are in place. However, no group classes can take place. Places of worship can open with the 4 square metre capacity rule and 20 person limit as well. Professional and outdoor community sports, including training, are permitted but without spectators. Indoor community sport is not permitted. No visitors to hospitals except for compassionate reasons, including end of life, accompanying a child and supporting a partner who's giving birth. 4 square metre capacity rule and 20 patron limit for beauty, nail and hair services will apply. In terms of travel, from midnight tonight, people can travel out of the Perth and Peel regions to other parts of WA. However, if you do, you must still follow strict restrictions when you are outside Perth and Peel, as do those who are already in the regions who have been in Perth and Peel since 12 p.m. Sunday, June 27th. Specifically, you must wear a mask. You will not be permitted to visit hospitality, entertainment and recreation venues or other public gatherings. People from Perth and Peel are able to visit retail venues and other businesses for takeaway only. Casual contacts identified in this outbreak will not be permitted to leave Perth and Peel until Monday, July 12. Those are the post-lockdown interim restrictions, and we expect, subject to health advice, they'll only be in place for the next 3 days. Perth and Peel will then shift to a much more relaxed transitional restriction for the next 6 days. Masks will not be required outside except where physical distancing isn't possible. Masks will still be mandatory for indoor public venues, including in the workplace and on public transport. People should use common sense and take a mask with them whenever they leave home. There will be a 30-person limit in all homes for indoor private gatherings and a 150-person limit for outdoor private gatherings. We will move to the 2 square metre capacity rule and 150 patron limit for restaurants, cafes, pubs, bars, casinos, nightclubs, entertainment venues and public venues for seated food and drink service only. The 2 square metre capacity rule and the 150 patron limit will also be in place for all other relevant businesses and venues similar to what was in place for Sunday and Monday gone. Weddings and funerals will be permitted for up to 150 guests. Outdoor gatherings can also take place with up to 150 people without a COVID event plan. Major stadiums, including Optus Stadium, RAC Arena and HBF Park, can operate at 50% capacity. We intend these transitional restrictions to be in place for just 6 days, from Tuesday until Sunday, assuming everything goes well and health advice permitting. We intend to take the final and sensible step and return to our pre-lockdown life by 12:01 Monday, July 12 in the morning, quickly, safely and sensibly. In addition, we still need as many West Australians as possible to get tested, whether they've been instructed to do so, have been to an exposure site or experiencing symptoms. The more people get tested, the more confidence we can have when taking these next steps. I want to thank everyone for their patience so far. You're absolutely doing the right thing. Even if you think it's just a cold or a flu, don't take the chance. Please get tested. Getting tested is one of the best ways to keep each other safe and get life back to normal. Today's case is proof that our short, sharp lockdown was the right thing to do. That acting fast when we only had a handful of cases meant we could quickly get on top of the Delta variant. All going to plan, businesses across the state will be trading unrestricted by Monday week. We'll also be in a position to announce our lockdown assistance for small businesses as soon as we can. I want to thank everyone for their patience, doing the right thing. Please keep it up over the next 9 days. Wear your mask, get tested, and get vaccinated. Thank you, and I'll hand over to the Health Minister.
Thank you, Premier, and good afternoon, everyone. During the past few media conferences, I've thanked all the health team for what they have done during this community outbreak. The nurses, the doctors, contact tracers, and everyone working at the testing and vaccination clinics. And today, I want to thank the people of Perth and Peel. I know it's not been easy during the lockdown, particularly during the last week of the school term and on the eve of the school holidays. But the way the community has responded has been fantastic. So I just want to thank everyone. And once again, I'm going to ask for your patience as we continue to work through this on the journey back to the pre-lockdown life. It is another busy day in our vaccination centres yesterday. 11,286 people rolled up for WA yesterday. That was 9,154 people in the metro area and 2,132 in regional WA. It was about 50-50 Pfizer and AstraZeneca. Pfizer, 5,617 doses, and AstraZeneca, 5,669 doses. We've seen an encouraging uptick in vaccination numbers this week, with 36,000 people in just the last 3 days. So let's keep it going, let's keep it up, let's keep that momentum. There are now been 733,408 doses across WA, 591,346 in the city, and 142,062 in the regions. And we're getting close to 600,000, 585,166 Western Australians who have now had at least one dose of either Pfizer or AstraZeneca. I cannot stress enough how important it is for everyone to get vaccinated when they become eligible. Roll up for WA, for yourself, for your loved ones, and for our community. We've also done well this week with everyone using the Safe WA app. Once again, I can't stress how important it is to use the Safe WA app, especially during the school holidays when we have a lot of movement of people. It has to be a habit, make it a habit. Our contact tracing teams need this information as quickly as possible to find close and casual contacts if there's another positive case. We've seen consistent numbers of around 1.2 million scans a day during the lockdown. Yesterday we had 1,233,264 check-ins, and there have now been over 268 million check-ins since the app began. The situation remains unchanged in our hospitals for the next 3 days after the lockdown. Unfortunately, no visitors will be permitted in hospitals except for compassionate, paediatric and obstetric units, for compassionate paediatric and obstetric visits. Masks are mandatory for all staff and visitors. Metropolitan hospitals will continue to postpone non-urgent Category 2 and all Category 3 elective surgeries until and including Friday the 9th of July. Where possible, outpatient appointments should be via telehealth, and if telehealth is not possible, non-urgent outpatient appointments should be rescheduled. Category 2 and some Category 3 elective surgeries in country WA may need to proceed where clinically required as determined by the treating hospital. I can also announce that elective surgery, non-urgent Category 2 and Category 3 operations in private hospitals will recommence, and healthcare outside the hospital setting, such as physio, radiology, podiatry and so on, will recommence also. Visits to residential aged care facilities remains restricted. As we know, COVID-19 represents a significant risk to older people who are particularly vulnerable to respiratory diseases. Visitors to aged care facilities will continue to be restricted to essential care, compassionate, end-of-life and advocacy visits. So that's pretty much where we are at the moment. It's pleasing that we've been able to lift the lockdown tonight, But can I ask everyone for a little more patience over the next few days? The last thing anyone wants is another community outbreak. So these restrictions send one message, but the message I want to send is that you should all do your bit for continuing to make Western Australia successful in managing the COVID-19 outbreak. Let's be safe, let's be sensible, and let's do the right thing. Thank you. I'll now hand you back to the Premier for questions.
Thanks very much, everyone. Any questions?
Can you talk us through, Premier, if you're a family heading out of Perth and Peel into the regions for school holidays, what does that look like for the next couple of days, just to be clear, so you can do takeaway only but not go to hospitality venues for long periods of time? That's
right. We had to work out, based upon health advice, what to do. Obviously, school holidays are upon us, so we've based upon the advice of the Chief Health Officer, allowed for people to go on holidays, but subject to quite stringent rules. You'll be required to wear a mask if you're from Perth and Peel, and you'll only be able to go to a venue to get takeaway. You won't be permitted to go to any functions or events or pubs or clubs or restaurants or the like. So basically that's the rule that we've come up with. It's quite tough. Clearly we rely upon the goodwill and the good sense of all people to comply with this rule, and we expect that will expire after 3 days, so on Monday night or Tuesday morning if you like, that we'll go to a new set of arrangements, but that depends upon the outcome over the next 3 days.
Premier, just as a follow-up to that question, for people who travel from Perth to the regions, post Monday and then until midnight July 11, if you've been in Perth and you go to the regions, do you have to continue to wear a mask indoors?
Yes, you do. So if you leave Perth and Peel, in fact everyone, so everyone in Perth and Peel until Monday, the July 12th, will be required to wear a mask, and anyone who leaves Perth and Peel will be required to wear a mask over that period.
Are you at all concerned that it's going to create some angst over the school holidays between the locals being flooded in with mask-wearing Perth residents?
Well, we just expect people to do the right thing. We're in the middle of school holidays, and it's obviously been a tough period the last 4 days. In fact, the last week has been a tough period. We've already had, you might recall, back I think it was Sunday, Monday, people were permitted to leave Perth and Peel, and they're required to wear a mask. So it's basically an extension of that arrangement.
Are you concerned that some FIFO workers have not been allowed to board planes, because there are reports saying that they have been stopped at the airport by federal police despite having exemption letters, and apparently they're from Rio Tinto?
No, I don't know any of those details. Perhaps I'll get the Police Commissioner to answer that at the end of this this event.
Premier, when did you find out this 21-year-old woman had tested positive?
I think I got verbally advised sometime last evening. But the good thing is that she's been in quarantine and she's been isolated, and she has not been infectious in the community. So now is the first opportunity I've had to come out. We've done National Cabinet, Emergency Management Team, State Disaster Council, preparation for today's event. So we're able to advise people now.
Do you know why it wasn't confirmed when we asked the Health Department, Health Minister's office last night before 6 o'clock? It wasn't confirmed?
No, well, I found out sometime last night. I was involved in a conversation at some point, but certainly the woman herself has been in quarantine, and she has not been infectious in the community according to the health advice we have.
On the back of what was decided at National Cabinet, will WA trial home quarantine for vaccinated travellers returning to Australia?
Not at this point. So the discussion this morning was very good, and we reached a lot of good outcomes. The South Australian government is going to trial the South Australian government is going to trial home quarantine in the first instance, so they'll give that a go. The ACT government advises that for diplomats, they've had that system in place and it's worked well in the ACT, but the South Australian government will trial it more broadly and more generally. I don't know the scale of the trial. It might be 5 people, it might be 10 people, I don't know what it'll be, but they'll give it a go and see how it goes. But I think the key point out of this morning's meeting is vaccination is king. We've got to get as many people vaccinated as possible over the course of the next 6 months or so before we can start looking at those sorts of initiatives more broadly.
Premier, can you understand that the 20-person limit, particularly for some hospitality places, just won't make it viable for them to open at all?
I do understand that. I do understand that. It's very difficult. So the health advice we have is it's the 4 square metre rule plus a 20-person limit. But for many venues that will be difficult. For others, takeaway and that arrangement will mean they can open. But I understand it will be difficult. So that will be in place for the next 3 days. That will be tough for many, and we understand that.
Now that you've got a path forward, have you come up with some sort of compensation plan?
No, as I said in my opening remarks, we'll have to work on that because we still have to get through the next 3 days and into the next phase. So the next 3 days will be crucial. So we need to have low numbers of positives, in fact, hopefully 0 positives over the next 3 days for us to transition into the next step down. And then by the end of that period, which is Monday week, hopefully we'll be out of all of this and we'll be back to what we've termed phase 5, which is basically normal.
So we've got this 4-day lockdown. The next 3 days aren't quite lockdown, but strict restrictions. That takes us to 7 days. So will that mean people qualify for the Commonwealth Government compensation?
I'll be writing to the Commonwealth to request that. The initial advice we have is no, because our lockdowns have not been perhaps severe enough as would normally qualify. But I'll be writing to the Commonwealth to seek their support for casual employees and employees who lost income. So we'll see what the outcome of that is.
Did you agree that lockdowns should only be used as a last resort, as the Prime Minister suggested?
Yeah, all the states and territories have agreed to that. And of course, you know, to be honest with you, I don't like implementing lockdowns. It is a last resort. You don't want to do it. But we've had to do it. Queensland's done it. Northern Territory's done it. New South Wales has done it. New South Wales has gone 2 weeks. I wouldn't be surprised if that goes for significantly longer. But until everyone is vaccinated, that's where we're at. That's where we're at. And just got to get people vaccinated across Australia in large numbers over the course of the rest of this year.
But just on that, so you've agreed to lockdown being the option of last resort. Obviously, it's very subjective wording.
Yeah, it is.
Does the agreement that's been reached today mean you're any less likely to impose a lockdown the next time this happens?
Well, I'll just say to you all, New South Wales waited till it was, 80 cases or something like that before putting in place the lockdown. They've had 30-something cases today. I prefer to avoid that. And so we have avoided that. So by acting quickly and swiftly, you're able to avoid those sorts of dire consequences. So that's the choice that we have. It is a last resort. I don't like doing it. You might recall a week or so ago, a bit over a week or so ago, we had a couple of cases. We didn't go to lockdown immediately. But obviously there were community cases. There was the concern about what was happening around Australia. And we went to this short, sharp lockdown. So it wasn't something we did immediately, but we went to it. And the alternative is what's now going on in Sydney. So Sydney, Wollongong, parts of the Central Coast, parts of New South Wales, it's an appalling situation. And I don't want us to end up there.
On the issue of National Cabinet, you guys are discussing phase 2 already on vaccination. So there are some areas of expressed concern. I want to ask you, when will children under 18 get vaccinated to get their jab?
When will what?
When will children and those under 18 will have the opportunity to get their jab?
I think that's further off in the future. So under 16 in particular is further in the future. I saw some advice on this in this issue today. There's trials going on overseas about these issues before we vaccinate children under the age of 16. So we expect that those trials will result in it being acceptable and medically safe and the like. And at that point in time, which is some way away, I expect, subject to medical advice, that people under the age of 16 will be eligible.
Can you shed any light? I know you mentioned before this lockdown we had a couple of days of kind of stage restrictions. But can you shed any light on what you consider a last resort scenario? Is it community cases or unknown community cases? Is it just a certain number of community cases that you have traced, or can you shed any light on that?
Well, it's last resort, as Peter said, it is subjective. It is subjective. New South Wales' version of last resort is get 80 cases and then you have community spread and a lockdown that might go for weeks and weeks, if not months. Our view of last resort is that you listen to the medical advice, you see if there's any prospect of community spread and try and kill it quickly and efficiently right then, rather than let it drag on and result in potentially catastrophic consequences. It's a very subjective question, but I think it's far better to have a short, sharp lockdown than an extended period of closure of your cities.
What was your point of to agreeing to that then, if it is so subjective and each state will still pretty much do whatever they want, it seems?
Well, it's a roadmap. So the Prime Minister has set out a roadmap, and it's a 4-phase roadmap across the course of this year and probably part of next year. And I think it's a good template for a way through this for the country over that period of time. But the first part of it, of course, is a halving in arrivals into Australia. And as we know, hotel quarantine, never built for these purposes. This will allow us, the halving in arrivals, to space people out in hotels. It's been referred to as, the, want of a better word, the zipper system. So you have empty rooms between people, and allows us to space people out in corridors so that transmission between one room to another from across a corridor, from room to room next door, we can absolutely reduce the prospect of that occurring. So that's hard on people overseas. That's hard on people who've been trying to get home to Australia. We know that, but we also have seen on dozens of occasions around Australia over the course of the last 18 months, transmission within hotels from room to room where we can't explain it. So this allows us to further space people out. So obviously, there's a whole range of initiatives in what the Prime Minister laid out this morning that allow for us to put in place a safer regime for all Australians, and West Australians in particular, but also a transition as people are vaccinated. And we've got to get people vaccinated as quickly as we possibly can, and everyone needs to be prepared to do their bit in terms of vaccination so we can head along this roadmap. And the end of the roadmap is basically, the final phase, is basically Australians being able to travel overseas. If vaccinated, you go overseas, you come back, and there's really no obligation on you to quarantine. If you're unvaccinated, you do sort of testing and the like before you can come back into Australia. So that's the sort of end, the hopeful end point of the roadmap.
How many quarantine hotels will WA be operating from July 14?
From memory, 6. So we've got 5 for returning West Australians, and we've got 1 for the seasonal workers that go and work on farms and the like, that come from Vanuatu and Tonga, I think. And so that's 6 hotels.
Okay, and then
just on the 20-person rule, some venues are asking, is that for the entire venue or for those bigger venues that have got the ability to separate rooms? Can they have 20 per room? It's
3 days for the entire venue. Look, it's very difficult. You know, my dad ran a business. I understand this. It's very difficult, but it's for the next 3 days.
Just to, some clarity in the gyms as well. No group fitness, whether that's indoor and outdoor.
No group classes indoors and outdoors.
No group classes indoor or outdoor.
Could you just clarify for us the changes to the international arrivals for WA over those coming weeks from July 14?
So from July 14, or perhaps even before, our arrival cap will halve. That will mean we will take in 265 passengers per week. And in addition to that will be seasonal workers, and they come through in fits and starts as to when an aircraft arrives with seasonal workers, but there'll be 265 returning Australians per week, which is the same as South Australia. And that means that we will be able to space people out in the hotels using, as I said, the zipper system, where you can space people further apart from each other, and that means the prospect of transmission room to room or across corridors is significantly reduced.
Was it raised that National Cabinet that Western Australia had already reduced its cap by 50%, so why does it need to do it again?
Well, our cap was prior to us reducing our cap, we had the highest per capita intake of anywhere in Australia, just so you know. When we reduced our cap, we went down to the same level as South Australia, which is a similar sort of state. We've got a bit of a bigger population, but not by much. The rule that the Prime Minister put forward was it would be a halving in the current cap. So our current cap is 530. Our new cap will be 265.
Is this going to make WA's skills shortage even worse for the rest of the year?
I wouldn't have thought so. This is about trying to avoid lockdowns and terrifying and difficult consequences. That's what it's about. We've gone through 18 months of this. I mean, I've stood here at this very podium on probably scores of occasions, answering questions about hotels and about difficulties we face there, about transmission where we can't explain from room to room, where someone might have opened a door next door to someone else at the same moment, and somehow this virus has got out a door, gone down a corridor and into the next door. It's very, very difficult, because then it means that we have community spread and we had to potentially lock down a whole city. So this is a difficult option, a difficult thing for people wanting to come into Australia from overseas, but it's the best thing, or one of the best things we can do to avoid community spread and lockdowns in the future.
The New South Wales Premier this morning said that well, she was upset that at the halving of the cap, and that other states hadn't done their fair share with arrivals.
She's upset with halving of the cap.
Yeah, she was. Yeah,
it was agreed to by all states. Just make that point. It was agreed to by all states.
Right.
And I just make the point that prior to us halving our number of returning Australians back 2 months ago, we were taking the most per capita of any state in Australia.
She agreed to it, but she did say that, she agreed to it given that that's the way that the other states wanted to go. But she did say that other states hadn't done their fair share up until this point. So.
Yeah, we should stop saying that. We were taking the most per capita of any state in Australia. So we were taking 1,030 per capita, the most of any state. So New South Wales' population is 3.5 times ours. So we were taking the most of anywhere. We obviously had that series of issues. We had reports that we released that said that some of our hotels were high risk, very difficult to mitigate. So we took the step of reducing our cap, and it's now been reduced again. So that's just a safety mechanism for both us. That's Western Australia, but also the rest of the country. What happened in New South Wales recently, where there was, and I'm not blaming anyone, but there's an outbreak and it spread to other states. That's the risk. It can impact not just your own state, but other states as well.
Are there any changes planned for the Victorian border, given they keep having 0 cases?
Not at this point in time. So the 14-day normal arrangement is until the middle of next week. So since the last time they've had community spread or community case, which I think was the 24th of June, the 14 days from that is Thursday, I think, or Wednesday or Thursday of next week.
Just on the roadmap announced today, why is WA not taking part in one of the initial trials for home quarantine?
Oh, well, we weren't asked to. So at the meeting this morning, it was clear that South Australia was part of it. But I'm more than happy to let South Australia do it and see how it goes.
A glaring omission from that roadmap was no time frame and no vaccination rates that need to be achieved to go through the stages. What vaccination rate do you think we'll need to see to move to this phase 2?
We haven't settled on that. Obviously, that's a matter that will be guided by scientific and medical advice. My view is it should be higher rather than lower, if I can put it that way, because for every person that's not vaccinated, they are at risk of getting ill and dying. I know I was advised today out of the New South Wales outbreak, where they've got how many cases? Yeah, how many cases in total? No, in total, in the total outbreak.
Over 220.
Over 220, 3 are in intensive care. So when you do the maths on that, if you get tens or hundreds of thousands of people who are positive, think about the maths on how many are going to be in hospital or intensive care. So that's why you've got to have a lot of people vaccinated before you even think about going down these routes. But I think everyone's pretty much of that view that Australia, as a, basically the most successful and prosperous nation in the world, we should have very high vaccination rates before we run this risk. But I also note, and I want to make this point, those people who choose not to be vaccinated, they actually elect not to be vaccinated, despite having had the opportunity and been offered it many times. When borders and those things do open, they're taking a risk, and that's their choice. That will be their choice.
So if you're an anti-vaxxer, you won't be allowed to travel, basically?
No. I think what you find, I don't know what the Prime Minister published, that people who are vaccinated will have easier travel and also the opportunity to return at the end of this whole process, which might be the middle of next year or whenever it is, without quarantine. If you're not vaccinated, well, the situation may be different. But I also note, and I think it's Qantas may have said that in order to fly Qantas, you'll be required to vaccinate. So that will make it hard if airlines put in place rules that you're required to be vaccinated before you can travel for people who aren't vaccinated to travel.
That vaccination number is going to be set by, scientifically. Will our show, or will there be some kind of representation from all states in that number?
I would have thought so. Yeah, I would have thought so. I don't think we didn't set out a formal process, but I would have absolutely thought so. Every state will have input.
Last questions for the Premier. The Prime Minister was basically saying Australia is victims of its own success, kind of implying that there's a complacency about getting the vaccine. But surely the bigger problem is not complacency, but hesitancy about AstraZeneca.
Well, I think there's both. Because we haven't had broad community spread of the virus, we are not as perhaps keen as a people to get vaccinated as other countries that have had mass deaths. And that's understandable. And AstraZeneca, of course, with all the issues that we've seen and the advice that we've had and the issues that have been out there publicly, has promoted some hesitancy. That's why the best thing we can do is get as much Pfizer as we possibly can, as soon as we can, and open it up to as many people as possible as soon as we can.
You've been so cautious, throughout this whole pandemic, and pretty forceful with your language in terms of the elimination strategy. So how big of a task is it going to be to convince the public when we get to these later phases that, we need to start treating this like the flu and people will start getting COVID? We're going to accept hospitalisations, that kind of stuff. Do you think you've kind of worked yourself into a corner?
No, it will be difficult, but we can't stay in our current condition forever. So eventually we're going to have to open international borders, and eventually people are going to have to be able to travel, and I think everyone accepts that. But it's just a matter of us making sure we're as safe as we can possibly be before that point, and making sure everyone has the opportunity to get vaccinated before that point. And I expect this will be a process that goes on over the course of the next year.
So when do you think Australia will move to phase 2 of the roadmap?
Oh, well, that's dependent upon the scientific and medical advice. We haven't set a date on that. We can't set a date. The Prime Minister was clear, and I think virtually everyone in the room agrees with that, that we can't set a date at this point in time because we need the scientific advice on how many people or what percentage of the population needs to be vaccinated before we can move to the second stage.
But it's not going to be 2021?
I don't know the answer to that.
The Eagles have a game.
Oh my goodness.
I'm sorry. They should have a game here this week. Anyway, they have a game here this week, possibly against North Melbourne. Will they be able to fly here from Melbourne, or how could that work? And will there be a 50% capacity crowd if it goes ahead?
Look, just in terms of, sorry, forgive me, I've been caught up. Is that this weekend you're talking about?
This coming week, possibly. They will be arranged.
So Saturday,
next
tomorrow
weekend.
week.
Next weekend, yeah.
Next weekend.
I think it's 50% capacity was what we said for, assuming everything goes well, for Saturday week, if that's the day, at the stadium. If everything goes well between now and then, I would have thought the coming weekend, tomorrow and the next day, would be very difficult. Thank you. Who do you want next?
Commissioner, perhaps?
Well, before I answer that question, I'll just respond to the question about the FIFO workers at the Perth airport. Police, as you know, meet and greet every traveller going through our domestic airport. This morning there was over 1,000 FIFO workers travelling about regional Western Australia. My advice, and I've just confirmed it in the last few minutes, there were 4 FIFO workers who did not travel. That was a decision made by the company that employs them. Police were there with them, we're aware of it. One of them is a painter, the other 3 persons are drivers. They were not deemed by the company as essential to travel. So it's not the case, as the question was put before, that there were lots of people stopped.
How many fines or arrests have there been related to breaching of COVID restrictions during this lockdown?
I don't have the exact number, Peter, but it's in the order of 6 to 10 that I've been briefed on. They have ranged from a man at a vehicle checkpoint that was charged with obstructing police and I think resist arrest. There were about 3 or 4 people charged with breaching the mask wearing arrangements, and they received infringements. And I'm aware of one other matter, but we had very good compliance from the community.
How difficult do you think it's going to be for your regional officers to enforce the transition directions, such as people going from Perth, visiting a takeaway, and then having to wear a mask until July 11? How are you going to enforce these rules?
Well, I think as the Premier expressed it earlier, we've had to take on the advice from the Chief Health Officer. We also recognise that the West Australian community have been very responsive and very compliant, and we've done this in this consent model that I've spoken about previously. We're doing this in terms of the best possible way of us coming to the other side of this pandemic as safely as we can. And the community, I think, have understood that while it's frustrating, while it hurts some business proprietors and things like that, and it restricts all of us in our movements. I've been in quarantine, for instance, for the last week or so. It impacts on everyone. But the most important thing is that we are working with the community, and where people are leaving Perth Peel, for instance, to travel on holidays, for this next 3 days, we are simply saying, be sensible, work within the directions. If there are people that willfully and openly defy, and we generally are approaching a position where we will warn people, but they face a fine of up to $50,000. Some people have been imprisoned over the past 16 months. So we're not going to take a soft touch with people. What we are directly, openly saying to people is, we're doing this for your safety. It is in your best interests to wear a mask, and for certainly of those people holidaying, for the next 3 days, you can't go to the pub, cafe or a restaurant. You'll just have to do takeaways for the next 3 days, and depending on how the advice comes from the public health, if we have no further community-based infections, then we'll transition to the next period on Tuesday.
So would there be more police officers at places like down south monitoring this, or do you urge business owners to ask people where they've been lately? Like, how will that enforce?
So look, we've suspended all rosters for police, so we're putting as many police as we can out there. But what we do know is that businesses themselves don't want COVID. So the business community and the venue operators have, I think, been operating really sensibly. They don't want it for their own business reasons and for public safety, so we would again appeal to not only the people who are customers, but those that operate the businesses don't want COVID in their premises and to impact on their business. And I'll refer again to the resource sector. They've been very sensible in being proactive about putting the right measures in place, and that's kept that part of the economy going.
So police officers will be working overtime at least for the next 3 days, or a little bit longer?
Oh, look, I'm sure some will do overtime, but no, we've rostered enough police that we believe we can adequately deal with it.
Just to clarify on the indoor gathering rules, the 10 people, do they have to wear masks?
When you are in your own home, you don't have to. In other venues, you have to wear masks.
So a friend's house, you have to wear
Well, when you transition to the next phase, no, in a private home, you don't have to wear a mask, but in all other indoor venues, you do have to wear a mask, unless, of course, depending where you are, when you're eating and consuming, obviously you don't need to wear a mask. But I think the general concept that people need to get their head around and apply is, if you're in your own home, you don't need to wear a mask. If you're in any other indoor premises, and you're in the Perth-Peel region, or you're travelled from the Perth-Peel region, you will have to wear a mask indoors and outdoors.
Sorry, not a COVID-related question, but 2 police officers in the last couple of weeks have tragically taken their own lives. How devastating is that, and is enough being done to support their mental well-being?
Look, the families of those officers who sadly have lost their lives, we are obviously supporting them, their loved ones, and of course the police colleagues. Any loss of life, of course, is tragic, but in these circumstances, we will walk with the loss and the families there. We do have care as one of our core 4 values, and there are both clinical, chaplaincy and peer support programs which we have put in place over many years, and we will continue to offer as much support as possible. Each death, of course, is a great tragedy, but we will continue to support all officers.
Just, sorry, on the Safe WA app, looking back now, do you have any regrets with allowing access, or your officers accessing that data, or are you standing firm that they didn't do it?
Oh, look, I've answered those questions previously, and I'm not being defensive. There has been legislation that has now amended the law, but the access for 2 very serious crimes were done lawfully. I stand by the fact that the officers were doing the right thing by the law, and they were for absolutely necessary reasons, one being a homicide, the other being a very serious crime. But with that, we accept that the Parliament has amended the legislation, and as we do, we will follow the law. Okay, thanks very much.
Can we get Andy? Sorry. I know it's Friday.
Do you want to go? I'm happy to shut up.
So on Tuesday, the Health Minister said that on the Sunday, when the outbreak was first kind of announced, that we had 40 contact traces, and that surged up to 100 on Tuesday, and then by yesterday there was 300.
Yes.
In your decision making, did we need to go into lockdown had we had more contact traces earlier?
We need to go on to lockdown is not done just because of contact traces, so that's probably the first point to make. Lockdown is around how do we stop the transmission of this disease within the society. We knew it was there. We knew that, and certainly by the time when we had 3 cases, we knew that it wasn't just an isolated case, and that we needed to stop the transmission chains that were occurring within society at that time. To do that, the lockdown gave us that opportunity to contact trace those people, but it also gave us the opportunity to test. So we've tested over 70,000 people over the last, well, basically since Saturday. And that gave us that real opportunity to get on top of it, to lock it down, to make sure that all of those people who had been identified as either close contacts or as casual contacts were either tested or quarantined.
And on the exposure site list, there's kind of a tiered level of sites. So you've got the sites where people have to quarantine for 14 days, and then the next level is quarantine until you get a negative test. Given how the fleeting transmission of this virus in this instance, why aren't people who have visited those locations being told to quarantine for 2 weeks?
So it's done on, this is based on national advice from our Communicable Disease Network of Australia as to how we should manage both close and casual contacts. In many instances, the casual contacts may have been in the general area, and we obviously are focusing on those ones who were in the immediate vicinity. We do realise at times, and we saw that I think with case 1024, where the person was some distance away. Now we still don't know. We've looked at CCTV and we've looked at the movements of the people on that night. We're still not quite sure where they contacted. It might have been in the car park that we couldn't see. We just don't know. So we have to allow for those. In those instances where there has been transmission, those areas become areas of close contact. So we have to continue to work, and that's why the number of those sites that move from casual contacts and become close contact sites changes. So some of the venues that you will have listed were originally considered casual and now close, and that's part of the contact tracing process.
Can I just clarify the Pilates and yoga thing again? So they can open with 4 square metre rule and 20-person capacity, but no indoor outdoor classes.
That's correct.
My understanding is just yoga and Pilates are classes. So how does
it's there are ways that people can obviously do individual exercise, whether it be Pilates or whether it be yoga. So at this stage, and it's only for 3 days, and I think people need to remember that it is no classes in any of the fitness centres, including dance classes, yoga classes, Pilates, or any other classes.
So they can go when as long as there's 20 people and it's not a class?
Yes, yeah, that's right.
Just very quickly, before we finish, maybe, what about what's the current availability of Pfizer vaccines in Western Australia? How much do we have, and are we on target at this point? Because some people still have to wait for quite a while for the second.
So yes, we are on target. I mean, we have, I don't have the exact figures with me at the moment, but certainly over the last 3 days, from our own area, we've been doing around 7,000, between 6,500 and 7,500 vaccines a day. About 1,000 vaccines a day are AstraZeneca. So we are moving through that. The last I looked, we are progressively, we had a reasonable stockpile, but that is decreasing as we vaccinate more and more people.
Dr. Robertson, the Prime Minister's 4-phase plan, a lot of those stages will be done on medical advice, but we've seen the medical advice differ so, wildly between states and the Commonwealth. Whose medical advice will it be, and how hard will you be pushing for your advice?
So the advice will be done through largely through the Australian Health Protection Principal Committee, AHPPC, and that has had good national agreement. While there may have been slightly different approaches in different jurisdictions, the nationally agreed advice has remained consistent. We've seen that with the Australian Technical Advisory Committee on Immunisation, the ATAGI advice, which has been consistent. There's a lot of very consistent advice on how we should manage hotel quarantine, how we should manage the different aspects of the vaccine program. So it will be based on that. It will largely be based on modelling, and that's obviously will be done by the modellers who sit on AHPPC, and a lot of that will be, if we get to what level, what percentage of vaccine do we need, so we're not going to get major outbreaks that could lead to serious disease and potentially deaths.
What did the modelling say the vaccination rate needed to be for the Alpha variant?
So there were suggestions for the Alpha variant that it needed to be in the vicinity of 80% to protect, and that 80% of the eligible population.
And the Delta would have to be higher?
The Delta would probably have to be higher, but I think we need to model that and to see, and it's really around the outbreaks that occurred.
There was some polling done last month that suggested that 1/3 of Australians don't want, or they don't want to get vaccinated for whatever reason. So that's only 70% of the population that probably will be without any issues. So how are we going to overcome that?
Look, I think there will be a number as we get to that stage and we implement. I think it will become. We will have to continue to work on with that group and to look at what are the reasons they're not getting vaccinated. Why are they hesitant to get vaccine? Is it concern about the safety of the vaccine? Is it concern about what health issues they have and that they're worried that the vaccine may exacerbate them. It's all those kind of issues. So we will have to work with those groups. But at the end of the day, it will be the eligible population will be offered it, and once we're convinced that everybody's had the opportunity to have the vaccine, then there will have to be decisions taken at that stage as to what opening up measures need to be taken.
Last question.
Just
Can I
to
just
clarify.
Can I just clarify some of the rules? I'm just getting a lot of messages about two things, and that is number one, can we just definitively say there are no classes indoors or outside? That's correct.
There are no classes indoor or outside.
And the other one is hospital visits. So what are the exemptions there? Can you visit someone for end-of-life reasons or someone who's having a baby? Is that just the partner who can go and visit?
So certainly for end-of-life reasons, people can visit. So there may be other compassionate reasons and they obviously will need to work with the hospital for that. Obviously, the partner or a support person for a delivery. So they're the sort of the main reasons. Or obviously, if you're taking a young child in, or to see a young child, that may be considered. The hospitals themselves, however, may impose their own further restrictions, but they're the main reasons why we would anticipate people would be allowed to go in and visit.
Just to clarify my question earlier about the alpha variant modelling, your response was the 80% would need to be achieved. Is that 80% needs to be achieved to move to this phase 2 that we've learned about today?
So what the 80% was based on is that we had largely we'd got to the end of phase 2B, so 100% who were eligible in phase 2B had been offered it, and we modelled, and modelling was done on around 70% and 80%, and it showed at that stage that you needed to get to those kind of percentages, 70 to 80%, before it really had a serious impact on the outbreak curve. So if you do it earlier, there is a serious risk that you may get a serious outbreak.
Thanks everyone.
Thanks.